Well, first of all, welcome to another opportunity for us to get the word out about what's happening within our community when it comes to COVID-19 and the crisis that we are currently in. Looking at the amount of cases, I think that it's important for us to do those right now. Currently now in Florida, we have 26,314 cases. In Broward County, we have 4,038 cases. In Dade County, there are 9,460 cases. I think the one thing that we can say about what's happening right now, there's a lot of anxiety that's out in the community when it comes to where do we go from here. Individuals who are not working, individuals who are daily running out of food in their households, and the question is, does anyone care the fact that my unemployment has not come through yet? I will tell you that myself and there are other state elected officials and your county elected officials who are working along with the Department of Economic Opportunity and making sure that we bring the relief that we know for a fact is needed within our communities. The biggest thing that we are dealing with right now is whether or not individuals will be able to claim their weeks. I will let you know that we were able to get the governor to do an executive order to ensure that you are able to collect your weeks. And we will speak more about that while we are in this conversation. But I'm going to move on to us talking to our guests that we have for today. As you all know, my goal is to bring as much resources as possible to the district and to the community, so you all can be very well aware of how do we get through. Today, we have not just a good friend of mine, we have a friend to our county, friend to our state, who has done and is continuously doing a lot of work within our community to ensure that we bring relief to families. And that is none other than my good friend, Dr. County Commissioner Barbara Sharief, who's here today.
Hi.
I'm happy you're here with me today, sis. It's you and I together. And listen, when I said I wanted to have this conversation, you didn't shy away from it, and I appreciate it.
No, I mean, right now we represent, our county commission represents about 2 million people here in Broward County, and people are scared. They are worried about the future. And I want to give as much information so that they can be comfortable with going forward and knowing what their next steps need to be.
Absolutely.
So I wanted to talk about a couple of things today that we've been getting a lot of calls about. So first off, we know that with the loss of pay comes food insecurity. People are having difficulties buying groceries. So it's not now at this point, it's not just about getting to the grocery store, but it's now being able to purchase food because they've not had income in some time because of the shutdown. So there are several agencies that are out there that are working to help us with this problem. The first agency is Farm Share. So Farm Share has been out there for quite a few years. They serve Dade and Broward counties. I'm going to give out a number, and that's 305-246-3276. That's 305-246-3276. Additionally, there's another agency, which is Feeding South Florida. That number for Broward is 954-518-1818. That's 954-518-1818. If you are in Dade County, that number is 305-633-9861. That's 305-633-9801. And if you have any difficulty getting in touch with any of those persons from Feeding South Florida or Farm Share, you can always call 211 in Broward. We have our 211 number open 24 hours, 7 days a week, and 211 it's kind of like our one-stop shop for everything. So if you're experiencing problems with your food, if anybody tries to turn off your electricity, you know they're not supposed to be doing that right now. FPL has suspended all electrical disconnection services right now. So if anybody tries to turn off your electricity, you need to be calling FPL directly. If anybody has issues with rent or landlords, you can go ahead and dial 211, and they'll be more than happy to get you to the right place to get the resources. And so right now, I know that this is a very panic time for many residents in Broward County. We are doing our absolute best to try to get to that point where we have COVID-19 under control and we can open up. But that point is not this week. I'm not sure when that point is going to happen. We are going to discuss that further at Tuesday's commission meeting and kind of figure out what an opening, a soft opening and a slow opening of our Broward County would look like.
So, Commissioner Sharief, a comment just came in and said, Feeding South Florida has been funded by the state. However, they are becoming more restrictive. Also, the partners are making up their own rules and requirement when the food is free for all. What do you say about that?
Well, I hadn't heard that before, but I can address that. And if Feeding South Florida is an issue and they're not giving it, we have probably about 12 or more feeding partners that are large feeding partners. And if you call 211 in Broward, you will get routed to someone else. And I will take that question and go ahead and do some follow-up on that.
A question that came in from the media said, can the commissioner speak to when does she think the economy should open back up? And is Broward prepared to help small businesses get back on their feet?
So actually, my conversation that's going to occur after this one is completely focused on small businesses. And yes, Broward is prepared to help small businesses get back on their feet. Right now, we've reached out to many lending partners. I can tell you that smaller banks, smaller institutions like credit unions are really doing well with the loans that are out there. I'm going to talk briefly about PPP and EIDL, the Economic Injury Disaster Loan that's given by the SBA. People who were with larger banks have been reporting more issues in terms of not being able to get processed. What my advice is right now is to go to the smaller lending institutions, for example, a Seacoast, a Legacy Bank, go to a smaller institution and try to get processed that way. But also you need to be ready with your paperwork. Some people waited for 2 weeks into the program to turn in their application and they were left high and dry. So I need to let people know you have to be ready with your paperwork. Paperwork includes your 2018 tax returns, your 2019 profit and loss balance sheets, because your tax returns for 2019 aren't due yet, okay? And you have to have your supporting financial information, which is your payroll, what you paid for payroll, what you paid for payroll taxes in 2019, those and your ID. Those are the things that you'll need to start your process. If your lender tells you that they're not taking applications at this time, what you would want to do is ask them what the application, if they're using the standard SBA application, if you could go ahead and fill that out and have your paperwork ready and turn that in at the appropriate time. People are saying that, they're just in a black hole when they submit them, that they're just sitting there. And so I'm going to do my very best on our next session with Pastor Saunders and Vice Mayor Johnson to kind of lay it all out. I know I don't want to take up too much time in this one because we have a lot to cover. Mm-hmm. But yes, there is money out there. Broward County has access to additional lenders. I'm actually going to be releasing a list of those lenders and those some sources where you can go if you have a very small business. We have been in discussions with our Office of Economic and Small Business Development. And what we have found is that businesses that are 20 employees or less seem to be the ones that are being left out or that have not applied quick enough. And so that's the section that we're going to be focusing on. today, and also tomorrow, you should be expecting to start seeing those emails. And if I encourage you, if you want the information, please just email me at bsharief, that's BSHARIEF @broward.org, and we will email directly to you all the information with the links.
Commissioner Sharief, so I see Yolanda Cass Jackson. I know she's on here, and so I know she's going to appreciate this question that I'm about to ask you. When it comes to our community health centers, and our community health centers they are crying out for supplies, PPEs. Can you talk to us just a tad bit on the importance of our community health centers and why we should be looking at them as a priority and a resource also?
Sure. There has been several what I consider first line response centers, like the community health centers, home health agencies. I've been saying this for a long time, that when we're talking about COVID, everybody considers the front line to be the hospital, but we have one of the largest senior populations of anywhere in the state of Florida, here in Broward County. And we have areas of Broward County where they are income challenged. And so they're not, healthcare for them is not readily available, and they are using community health centers, and they are using urgent care centers, and sometimes the emergency rooms. What we are hoping for, and what I've been encouraging, is that people go ahead and through their emergency operations director and manager, there are forms that they can fill out and request personal protective equipment. I have a map here, which I'm very happy to post for everybody. But if you are a healthcare provider, that means community health or otherwise, if you are in need of personal protective equipment, the governor and the federal government, they are in the process of trying to get that equipment distributed. There's two short forms that you'll have to fill out in order for you to be eligible to get some of that equipment. So right now on my list, Tracy Jackson is the person that you would be able to contact in Broward. That number is 954-801. Hold on now. Oh my goodness, I should have got my reading glasses. Okay, 954-831-3908. That's 954-831-3908 in Broward. If you are in Miami-Dade County and you're in need of personal protective equipment and you need it from the state or the county, that's 305-468-5400. 305-468-5400. Now, what you would have to do is you would go through, and there are forms like this one. It's a very short form. It has what your name, your facility type, I'm home health, and it asks you what you need, your resource, and you just fill out this form. And it's, like I said, it's 2 pages there, and then the third page is just a distribution request. It requires that you have asked around, you have tried to get equipment. It asks you what are the sites that you went to find the equipment. So for example, mine was Meccasin, MDS, Pillbox Pharmacy, Amazon. I went to CVS, Target, Walmart, Lowe's, and Home Depot websites. And then I found a place for gloves, which was glovesaver.com. So I submitted because I couldn't get masks and gowns. And so I was allocated some masks, and I have not received them as of yet, but hopefully they're coming soon. And for those of you out there who are in community health, if you need resources, that is what you need to do. And State Representative, I would be more than happy to post my map in a readable format.
I appreciate that. There's a question that came in from someone and asked, is there any help to help assist people with rent? Another month is approaching. And so I'm sure there are others on here who want to know what other resources are out there with rent. Now, Before the commissioner answers this, I do want to let you all know that the governor has made sure that evictions were blocked for I think until May. What's the date? I think it's May 30th. I think the date was. So if you're having issues with landlords or issues with your rent, where you are finding yourself in this difficulty, I know our office just helped a couple of people last week. Definitely shoot me an inbox message, and we will get you over to legal aid and to some other people who could help you to make sure that you do not find yourself in a predicament where you're going back and forth with landlord in the middle of a pandemic. But Commissioner Sharief, you can, if please, you're more than welcome to answer that also.
Yeah, so we have 211, which will help them to get to the right agencies, but I have a couple of them that I can give out. So for one, we have the Broward Partnership for the Homeless. That number is 954-832-7029. That's 954-832-7029. That's the Broward Partnership for the Homeless. We also have the Broward County Outreach Program for Women and Children. That's in Hollywood, and that's 954-926-7417, 954-926-7417. And then for veterans and family services, we have the Salvation Army, and that one is 954-524-6991, and that's 954-524-6991. And like I said, all of this information, if you're listening, if you didn't have a pen, if you're not able to write, you can always call 211 Broward, and they would be more than happy to get you to the right place. But we do have assistance for people out there who need rent.
Well, so with that being said, Commissioner, yeah, we have with so many people who are looking for these resources, and so much that's happening all at one time. How do you think we as a state, how do you think we're responding to this?
I think we were caught off guard because we've never experienced anything quite like this before. And so I would say that we are doing okay. I don't think that we're perfect. I don't think anybody's perfect in this situation. I think we still have some things to work through based on the size of our state and the number of people that we serve. There are other states that look like they're doing better, but they have more distance in their population. They have, acreage between them. We are in a community where we are very closely populated, and so we are going to have easier time spreading the virus than in other places. That being said, our community health partners, like our hospitals, our nursing homes, and let me just say that ALFs have really gotten a bad rap over the last few weeks about this virus spreading through there. But you have an issue in the community. You have an issue when you're talking about healthcare and healthcare providers. When somebody leaves their job and they go home, they're exposed to whoever in their house that they were exposed to. So they're bringing that back. A lot of these people that are in these facilities, they're not moving. People are bringing COVID-19 into to those facilities and passing it on. And so we just have a tremendous issue with asymptomatic people in our community that are passing this virus on to those people who are well. And that's why we continue to see the spread. The purpose of the CDC asking people to wear face coverings now, and for Broward County to ask you to wear face coverings in public, it's not because we are trying to make somebody not give you something, but it's two reasons: to protect yourself, number one. So if you're an asymptomatic carrier, you're not transmitting the virus respiratorily or through the air when you speak. And also, if a person is asymptomatic and they're working in a grocery store, or they're working in a gas station or someplace where it's an essential business, well, they're protected too, because we're finding that grocery store workers are getting this because they didn't have it, but they didn't have protection on. We're finding that people that work in the community and just these essential areas like Target, Walmart, Winn-Dixie, Costco, Publix. These people are putting themselves out there, and we have to protect them. So the way that we can protect the community from spread is by using a face cover. I also posted a video last week in regards to how do you properly use gloves. I've seen people take gloves, touch over everything. A glove is a surface. It is a surface just like your hands. The surface is meant to keep your hands from getting dirty. Once the glove is dirty, you should be taking the gloves off and disposing of them. You should not throw them on the ground in the supermarket parking lot. That's bad, and other people have to pick it up. You should take your mask off and dispose of it properly. Keep a bag in your car to dispose of protective equipment properly. And when you're using them, understand that once you've touched something like a cart, like the checkout counter, like the keypad when you're leaving, those gloves are contaminated. So we need to stop the spread. And this is why we're asking you to do what we're asking you for. We would love to open our park up. We would love to open our community up. But the reality of it is until we get people to understand the importance of following these guidelines and also the social distancing, it's going to be very difficult to not open up and see a second wave of COVID-19 sweeping our community.
Oh, and well, which leads me to somebody just posed this question, and I think it's a very good question, because even on interview yesterday with WPLG, I made it clear that I agree that we should put task force together. We should start looking at ways to open up the economy, but not no time sooner until science tell us that that it's safe for us to do so, and then we have enough testing locations. Someone just asked, so when will we begin mass testing based on the asymptomatic carrier concern that was just shared?
So that's something that I've been asking for quite some time now. And we all know that there is a shortage of tests that we can use for that. Right now we have, as of 2 weeks ago, there was brought forth a 15-minute, what they call the rapid result test by Abbott Industries. And I'm hopeful that that would be something that we will have in full scale distribution over the next coming weeks. That pretty much is the only way to do really fast mass testing. Right now, we currently do nasal swabs, and those swabs take anywhere from 3 to 5 days to come back and tell you whether you're COVID positive or not. In those 3 to 5 days, we know that people are going out and they're possibly spreading to other people when they have mild symptoms or they're asymptomatic. And right now, still, we're telling people, if you feel like you might have been exposed, if you're feeling symptoms, to go get tested, but we're still not handling the asymptomatic people very well. And so that's part of the reason why I don't feel like we're going to be ready to open up this week or maybe even next week, because we just don't have the testing that we need.
Like Dr. Fauci said, we're not the ones to put the time frame on coronavirus. Coronavirus give us
Yes, well.
Well, we have about what time is it? We have about 5 more minutes, and so we always end. Well, first, thank you. I appreciate your friendship. Thank you for doing this. You have quite a few people who are watching, and they're thanking you for your service over the years, also. But also, I love to end our conversations with everyone giving what's known as a hope message. So what message would you give to the community during this time?
So the first thing that I would say is that we have been through challenging times before. We may not have had a pandemic, the nature of COVID, but we had HIV and AIDS. We've had the avian flu. We've had H1N1. And I think that we have handled that the way that America does handle that, and that's by getting together, uniting, and acting as one. I believe that if we stay calm and we stay focused, that we can all get through this together. I know that there's a lot of panic out there, and my message on my page this week was keep the faith. And so I would say to you, keep the faith and know that you are not alone, and you have people like myself and others who are working very diligently in the background to try to help you as best we can. If you are out there and you feel like you're alone or you feel like you are struggling, I would encourage you to call You can call my office at 954-357-7008, and we'll assist you in any way that we can. That's 954-357-7008. We'll get you the help that you need right now. And for small businesses and those out there who are struggling with unemployment, we are pushing as hard as we can. You know, it is not lost on me as a two-time mayor of Broward County, going through some of the most horrific tragedies, shootings and you know, hurricanes and things that put people out of work for 2 weeks. And I just want you to know that we understand the gravity of this situation, and we're working as hard as we can to get our county back up and running. So there is hope, there is help, and you are not alone. And we can do this together, Broward County.
Yeah, I appreciate that, Commissioner Sharief. And I do also want to say, you just said something that I don't want us to end without me giving this number, because as you are, one of my good friends committed suicide on Friday, and I know it's a tough time for a lot of us. But if ever anyone that's out there, if you feel you're feeling hopeless and you're not feeling like yourself and you need someone to speak to, I do want to give you the National Suicide Hotline. That number is 1-800-273-8255. That's 1-800-273-8255. Commissioner Sharief said, you're not alone. We're all in this and together. And there are definitely people out there who really do love you. So I definitely want to make sure we end on that note.
Thank you, and I really appreciate you. I appreciate all that you've been doing. State Representative Shevrin Jones, who I call Chev. So this is my brother from another mother.
Yes. Yes.
And we have developed such a strong relationship over the years. And
Yep.
I'm here whenever you call, whenever you need me. I will be around to do whatever it is that I can do to make things better. And I think you're doing one heck of a job. I think that we're all doing the best that we can to get through this. And while I know sometimes the best is not good enough for everybody, we are going to get through this together. Please stay prayerful, stay hopeful, and we'll continue to work on our side.
Thank you so much, sis. Much love to you. See you later.
Take care. See you all.
All right.
Bye.
Bye.